Hello, I'm Dr. Bowers, and in this video I will be showing some exercises that I have found helpful for myself. Nothing in this video is a substitute for in-person, hands-on medical care. What works for one person might not work for another. So if someone tried these exercises and experienced pain, they should stop and seek professional healthcare advice. Besides making YouTube videos, I also make illuminated manuscripts. The one pictured here took me about 40 plus hours to make. That's a lot of hours to be sitting in a chair hunched over a table. It used to be that when I would get up after hours of drawing, painting, and gilding, my back would feel stiff and tight and complain for the rest of the day at least. But then I figured out how to reset the tension in my back, and my back now feels pretty much fine when I stand up after having been seated and bent forward. You may not have a hobby that involves calligraphy and illumination, but most of us from time to time find ourselves bent forward for too long while doing something in a seated position. Staying in any position for an extended period while a force like gravity pushes or pulls on the body causes something called tissue creep. Normally, when we are standing or sitting up straight, our psoas muscles contract to stabilize the lumbar spine and our low back. But when we sit like this, the two ends of the psoas muscle become close to each other, and this affects its ability to effectively stabilize the lumbar spine, or our low back. At the same time, gravity is causing the soft tissues of our back to gradually stretch. This prolonged shortening of the muscles on one side and lengthening of those on the other side sends signals to our nervous system that causes it to alter the tone of those muscles. That's why when we straighten up, our back may not feel so good until the nervous system is able to reset the tone in the affected muscles and the tissues have time to reverse back to pre-stretched length. Normally this takes a while, unless one knows how to speed it up. Here's how I reset the muscle tone around the spine and torso and help speed up tissue creep recovery so that my low back won't feel so bunched up when I straighten up. If it feels bunched, I go forward to where it didn't feel bunched up anymore, and I push my toes on the floor kind of like pushing on pedals. I do that for a few seconds, then straighten up. If it still feels bunched, I go forward a little bit and repeat pushing with those toes. I straighten up, it still feels bunched, I go a little forward, and I push those toes down for a few seconds. I keep doing this, straightening up until it feels bunched, going forward a little, pushing the toes down, relaxing the toes, and straightening back up, until eventually I'm able to straighten all the way up and my back doesn't feel like it's bunched up. Ideally, I would do this reset before I even straightened up that first time and felt like my back didn't feel quite so well. But if I forgot to, I can always lean forward and do the reset. Also, if I'd already gotten up and that's when my back starts yelling at me and I go, oops, I forgot, I can sit back down, bend forward again, and then do the reset. A few of my other hobbies can require me to bend forward when I'm seated or standing. If I'm standing bent over for too long, I can use the exercise I just showed you to help my back. I just go find a chair, sit down, and perform the reset. When performing activities that require bending, it is important to do so properly, and I have another video on this topic. One important aspect of proper bending is bending the knees, but oftentimes we forget or don't realize it. Unfortunately, a straight knees position puts tension on the hamstrings, and that tension pulls on the pelvis, affecting pelvic tilt and iliosacral lumbar tension. The sacroiliac joints, also known as the SI joints, become compressed, and the lower vertebrae of the spine and the tailbone are forced into a position that does not allow them to flex and extend the way they normally do. So if someone straightens up while their knees are straight, their low back and tailbone often stays partially stuck in this position. This negatively affects the back and can cause problems elsewhere. Luckily, this is often easily corrected if the tension from the hamstrings is removed while in the bent forward position. Straightening back up when the knees are not bent keeps the low back in misalignment. This might cause pain right away, or it might start bothering later. I correct this type of iliosacral lumbar misalignment by bending forward again with knees straight, then bending the knees and keeping them bent, while I straighten back up, leading with the shoulders and head while looking up. The last thing I straighten is the knees. They need to remain at least a little bit bent until the very end. I don't usually straighten up this slowly like I am in the video. I'm doing it slower to exaggerate which parts move when. This repositioning exercise is most helpful when done right away, but it may correct the malpositioning even if done much later. I sometimes have to help patients do this in my office when I feel their back is stuck in this position. Depending on how long their back was stuck in the position, I may have to work on other areas to free up any compensatory dysfunction they developed as well. Remember, there are many reasons for low back pain, and some of them are life-threatening. Make sure to see a physician if you are experiencing severe pain or pain that persists, or if you have any medical questions about your health.